Hi, welcome to The Winning Formula, a new podcast from Gig Health. Every month we'll be looking at a new challenge facing the life science industry and talking to an expert about how the industry might respond to it. And in this first episode, we're taking a really close look at trust, what it means, what it achieves, and how to preserve it and maintain it, maybe even grow it. And to help me tackle it, I'm really pleased to welcome from Ipsos, Helen Bennis.
Thanks, Tim. So my name's Helen. I'm a senior director at Ipsos. So my background is working in the healthcare industry for the last 20 plus years. I've worked in the APAC region as well as the UK, and my focus has always been, understanding people. So my academic background was psychology and neuropsychology as well. So I'm always really intrigued in, why people do what they do, what's driving behaviour. Which then led me to an interest in behavioural science, behavioural economics. So understanding trust, how you build trust is really important to me. So yeah, very pleased to be here on your first podcast today.
And we're delighted to have you, especially on this topic of trust. I think the temptation can be, if you have really compelling data, then the healthcare community will trust it and your product will perform capably. But that's not the whole story, is it? There's so much more to trust than data itself.
Absolutely. And I think it goes back to that regulatory environment where, some companies do hide behind that. And, what they are allowed to talk about is data and clinical trials. To go beyond that means, taking a little bit of risk on as a pharmaceutical company. But that's where you create a connection with your patients. So when we talk about building trust, that is about connection, is about demonstrating that you do share something, whether that's values or not. So even if you're taking on a little bit extra in terms of risk by putting something beyond clinical data out there, the rewards are going to be much more than potentially the risks, in my opinion.
It's not just the life science sector, the pharma sector, where trust is eroding, is it?
No, and I think one of the critical things that drives that or is driving that is just the pure, exposure that we have to information on a day-to-day basis. As a consumer, we're bombarded with information, really, aren't we? We can access it anywhere we are, on our phone, on our laptop, when we're at work, in between breaks. And a lot of that information is, and increasingly so perhaps, actually contradictory. So you'll be looking for a particular piece of, an answer to a question, for example, and you're going to come across lots of contradictory information or views. So it becomes really hard as a consumer, as a person, as a patient, to really understand or to know who or what to trust. So we run something at Ipsos called the Ipsos Global Trends Data. So this is something that's been running for the last decade. We survey more than 50,000 people globally across 53 countries, looking at various different, trends across the world. Trust has always been one across those 10 years, and we have seen, as you said, that erosion of trust. But one thing that's really interesting is looking at how people engage with brands, how they feel about brands. And across those 10 years, and dramatically, and more importantly, actually, within the last 5 years, we've seen a steady decline in the agreement with statements that look at consumers' willingness to pay more for a brand that they're familiar with, and actually a steady increase in agreement with statements around I would be willing to pay more for a brand that aligns with my personal values. So you've got to offer more as a brand for a consumer to be willing to engage with you and to be willing to spend more. And you see that behaviour and that sentiment bleed across into healthcare. We're, whatever we do in our regular life is how we behave, as a patient. So we have other data as well on that Ipsos Trends data that shows that people are routinely looking elsewhere in addition to their doctor. So I think it was 68% of people in this survey would seek information or health information for themselves in addition to going to their doctor. And that kind of echoes what we're seeing in the consumer land where, if a brand isn't aligning with an individual's core values or personal values, they're willing to look elsewhere. In between that consumer and health, you've got this wellness industry that's emerged within the last 5 years or so. And that's where we look at and, putting aside misinformation and disinformation and all that kind of thing, if we focus on influencers within that space, the success of these health influencers relies on the ability to communicate those shared values and to create a sense of authenticity and accessibility that allows an individual, even if they've never met this influencer, to feel like they have a connection. And that's possibly where the health industry is slightly out of step.
So it seems to me that it comes down to the entirely reasonable position on the part of a patient walking into the doctor, that they know themselves and their needs equally well, just from through a slightly different prism, to the doctor who'll be approaching it instinctively from a clinical perspective.
I recently had a conversation with a medic, with a healthcare professional, around how training needs to change. We were talking about the training of medical professionals. And this particular physician was saying, he was mid-40s, and back when he was trained in medical school, a lot of the focus was on rote learning and knowing information. So he gave the example of knowing every bone in the body by its Latin name. That was his example. And he was saying, we shouldn't be focusing on that anymore as an industry, as doctors. And even really, steering away from the need to synthesize or to derive meaning from data, because eventually, and even probably in the next few years or so, to varying degrees, generative AI or systems like generative AI will be able to do that for doctors. In the future, the key skill that doctors are going to need is to be able to bring that human eye to data. So to be able to look and go, well, there's an anomaly there, there's a gap, or there's something there that's missing and that needs to be resolved. And a key skill there will be in being able to talk to the patient, because often that's what's missing when we look at healthcare decision-making, is the view of the patient and recognising the value of a patient and their own views and understanding of their symptoms.
So in a doctor's surgery, then, trust is a two-way street. If a doctor's going to expect their patient to trust them, then the doctor needs to trust the significance and the importance of what the patient's bringing. And I wonder if that's where we begin to see a role for pharma, for life sciences, in terms of involving themselves in the patient experience and helping patients to advocate their own positions and feelings better.
I think when we go back to industry, it feels like, the NHS should be responsible for this. But actually, we know how overstretched they are. We know the budgets are limited. And we've worked with a number of charities that have actually stepped in to fill that gap. So Outpatients is an organisation that advocates for those with cancer in the LGBTQ community. They offer training to healthcare professionals on how to communicate with this particular community in terms of understanding their individual needs, in terms of understanding their challenges. And there's many other examples of this within the healthcare sector, most of which we don't know about that's actually happening. And certainly, pharma is funding this training, maybe not, not something that they're talking about, but certainly they are doing that. And so that's a role that they can play. But also going back to your point about patients, I think this is the critical area in which pharma can really play quite a pivotal role. As a patient going into that conversation, as you say, you need to feel that you have the information, but you also need to feel that you have, the permission to be able to challenge if and when you need to. And, I think in the healthcare industry, there is this default belief that you create information and therefore you inform. Well, as well as I do, that that's not the case. You have to create information that is, where people are, where patients are. So, that it's actually seen for them to engage with. And then once they're engaging with that, they need to be able to see themselves in that. It needs to talk to them. It needs to resonate with them. And lastly, they need to be able to understand it. Health literacy is very varied amongst the UK population, both in terms of the language that's used to describe medical issues or terminology, but also the data, way in which data is presented as well. Numerical health literacy is very varied. So industry can work with organisations like the Patient Information Forum to make sure that what they're producing is of of a standard that the vast majority of the population can understand. But also they need to collaborate. And they do. There are examples of that, which I'm sure we'll talk about. They need to collaborate with those within the industry that can help them understand where the patients are, what's important to them, so that what they're producing is resonating, and therefore gives them that ability to sort of advocate for themselves.
Within our clients in healthcare, we're seeing new roles being created. We're seeing new energies and teams and initiatives being directed towards patient engagement, towards meaningful consideration of where the patient fits into the picture, and usually at the heart of it, ideally. I just wonder what your take is on whether or not, compared to the skyscrapers full of people working on sales and marketing, whether or not pharma is doing enough in that area.
I agree with you that patient advocacy roles, certainly something that we didn't see 5 years ago, certainly not 10 years ago. So that's a huge step forward, which is brilliant. In the conferences that we go and attend to that you've just been referencing, again, are a huge step forward. And those patient advocacy roles are those that feature quite prominently there. We've heard lots of brilliant examples around what those patient advocacy roles can achieve. 2 companies come to mind, so AstraZeneca and MSD. We've worked with both of those companies in the advocacy role, where they have done a number of different initiatives. So certainly working with the Patient Information Forum in terms of the communications they've been presenting or creating. So those that address the issue of health literacy, for example. They've also worked very closely with patient advocacy groups and charities to understand the patients more, but also doing work behind the scenes, if you like, stuff that we don't hear about. So working with the NHS to optimise care pathways, going to the communities and community care organisations, those that have the best knowledge of what needs to change for patients. But I would also say that there's huge variability across pharmaceutical companies in what they do. I mean, these are great examples, but some aren't doing this, or some aren't even having patient advocacy roles. So stuff has been done. Could more be done by industry? Probably, yes.
And I wonder if there won't be anywhere to hide soon as well, particularly when it comes to patients circumventing established systems entirely, which we're beginning to see now, for example, with GLP-1s. That rewrites the book, and it seems to me a moment where pharma have a chance to, evolve or die, to be honest.
Yeah. And as we mentioned at the start around healthcare being out of step, the regulations, going back to those, are also out of step. We haven't been able to, within Europe, within the UK, being able to directly communicate with patients ever. The US, completely different rules. I think New Zealand's the only other one that can directly communicate with patients, direct-to-patient comms. But, those regulations were created in, a world that doesn't exist anymore. That there is, to your point, as the world changes, as healthcare changes, as patients have access to medications, outside of that kind of regular, healthcare professional route, that those regulations must change and should change. And I think we will see those change in the future. Out of pocket is going to increase. We know the healthcare system is overstretched. It's likely to continue to be overstretched. The GLP-1 example is a great example of just that, where you've got patients opting to almost circumvent their healthcare professional to be able to access a medication with very little, kind of input from what we would consider to be a traditional source of information.
We're seeing a trend towards patients removing themselves from the traditional healthcare provision model and going out of pocket and saying, here's my money. I know what I know, and perhaps I've spoken to or listened to an influencer about it, but I don't need a medical degree opposite me on a desk for my prescription. I'm just going to get it. In that system, is trust even still relevant? Is there a place for trust between the provider of that medicine and the patient when really they've formed their own opinions and they're believing in it strongly enough to fork out their own money? Rather than wait a bit longer and get it through reimbursement.
So I think pharmaceutical industry needs to embrace more of that consumer mindset. So as we mentioned at the start, what what patients are willing to engage with and pay more for and choose are those brands, are those companies, are those individuals that allow them or demonstrate shared personal values. And that's not something that the pharmaceutical industry have been able to do directly because of the regulations around what they can and can't say to patients. But certainly, as we've mentioned, those regulations are going to need to change. The world's changing. We know that they're out of step with what the society is and how we engage with healthcare. And there's a lot to be learned from what's currently happening in the wellness industry, what's currently happening with health influencers. The reason why health influencers are successful is because they're offering consumers something that they want. And that is trust. And they're building trust through authentic conversations. They're building it through accessibility. You know, a patient can engage with an influencer 3 or 4 times a day, build that connection, even though they've never met that individual.
If pharma buys the time of an influencer and then at the end of a segment purporting to be authentic, up pops their logo at the end, I feel that has a detrimental effect to the engagement in the first place. So you're saying that it's more the mindset rather than the actual resource that the life sciences and pharma sector needs to take on there, right? So don't so much look for influencers to partner with, but be more influencer.
Absolutely. Or I think there's probably a combination of the two, but perhaps the authenticity comes in what's the goal of that partnership or that interaction. So if you are authentic in your goals, perhaps it doesn't have to necessarily mean that every single interaction or information that's released is, without free from bias.
So I think we're agreed there's more to be done, but at the same time, more is being done. So we're on the right track. I just wonder if there's anything in your work from Ipsos, trends you've observed or patterns, insights that you would pass on.
So my piece of advice is, really being able to recognize the value of one another within those companies. So when it works, it's because what each function is doing is mutually beneficial to the others. And I see that working when data is shared. So data is healthcare's currency, isn't it? It's a currency everywhere. A lot of the data that's generated by commercial through customer segmentations, for example, is also data that the patient advocacy leads can also use. So even if your patient segmentation is focused on priority targets in order to drive sales, you've got a whole bunch of information about patients who don't fit into that bucket, that are generally those that are underserved. And they're the ones that are probably the focus for your patient advocacy leads. So it's about recognizing that, you might be doing slightly different things, but actually what you're doing is mutually beneficial or can be mutually beneficial across those different parts of the business. And I would say the other key one is about collaboration. When it's done well, that's when you see things working really well. So collaboration both within the organization, but also within the pharmaceutical, within the healthcare sector as well.
So in other words, if you want your external stakeholders to trust you, you'd better make sure that you're trusting each other internally.
Yeah.
I think that's a good place to leave it. Thank you so much for coming in, Helen.
Thank you for having me.
And we'll hope to see you again for the next episode of The Winning Formula very soon.